So let's take a look at Chip, and we'll just lay him right on my lap.
Okay.
And hi, Chip. You're such a good guy. So things we're looking for with an infant. One of the first things I look at is color of face. He might be a little pale in the cheeks, but not bad. A lot of children that have tongue ties, lip ties, their cheeks aren't going to be chubby. They're going to have skinny cheeks and other issues. So as I tickle his face, I'm also looking to see how far his tongue will come out, because we'd like to see his tongue come past his lips, which he does, and he's starting to show me a little bit. He's got a little tongue tie in the back. So, all right, Chip, you're doing a good job. I'm going to tip you up a little bit,
Okay.
and we'll put some gloves on. All right. Okay, we'll lean him back. Okay, Chip, let's take a look, buddy. Yeah, hi. Let's play, okay? So what we're doing now is I just want to see if I can get a little suction to see if he'll play with me a little bit. And there he goes. He's trying to get my finger. But he's a little gaggy. So if kids are gaggy, they often have a problem with the tongue or the lip ties. And so he's pushing forward more than wanting to swallow with his tongue. You can see how he's not really sure what to do there. And so I think that's probably why it's difficult for you to nurse also, because he pushes things out. Also, I'd like to be able to get my finger gently back to the soft palate without any gagging. And I'm feeling to see how firmly he's going to suck. If there's a really weak sucking reflex, then he needs help before you do a surgical release. If he's got a good sucking reflex, then he's going to do really well.
Okay.
You can also see for Chip, his upper lip is really passive. He's not using his upper lip.
Yeah.
So you can see how his lower lip's coming out. This one's not doing anything. So I suspect we'll see that upper lip is tied.
Okay.
Okay. So, and you can also see how the corners of his mouth aren't sealing up to my finger.
Yeah.
So, and he just made the clicking noise. Right? So we're going to look for that. All right, buddy. Also, when we're doing this, we also look for any curves in the body. Like sometimes you'll see an infant where their whole body is curved in a C shape. They'll curve left or they'll curve right, and that can come from a really severe tongue tie.
Okay.
Just because they're using their neck and their shoulders to swallow instead of their tongue.
Okay.
So, all right, buddy. There you go. You're doing so good. You're doing so good. All right. But yeah, you can hear him making those sucking noises. Okay. All right. Well, let's take a look and see. Let's see what we got here, Chip. So we're gonna take a look first at the upper lip. And here what we can see is he's got a lip tie that goes all the way from the lip, and it goes up to the edge of his to the roof to the ridge of the gums. And when I pull on that, it turns the gum tissue white. And so that's uncomfortable for him. So for him to let his lip go all the way up to the nose is causing pain.
Okay.
So he can't get a good seal that way. So we check the upper lip, and then we check the back corners, and with my finger in there, he has two tight spots. He has two tight ties in the back corners. I don't know if we'll be able to see that, but I can feel them with my fingers.
Okay.
So we definitely need to release the upper lip and the two sides.
Okay.
And that's going to solve the seal problem.
Okay.
Okay. And then we're looking at the lower. He does have what we call a posterior tie on the tongue, which I don't know if I can get a good picture of it. I can see it from my angle. There we go. Okay, so when we retract and then we stretch, you can see it right there. And that could be what's causing him to push with his tongue to push the pacifier out.
Okay.
So he also tends to have a flattened tongue. It's not coming up very far. So I think we should actually release the tongue a little bit and then do the three on top.
Okay.
And you can see how his tongue is pretty flat when he cries.
Yeah.
So we'd like to see that up and out.
Okay.
And we'll see that. All right. Okay, Chip. All right, buddy.